Facebook page and our YouTube channel. Out and About, rediscovering the untamed beauty of Spice Country.
Drug abuse, cancer,
measles, diabetes, AIDS, cancer,
Pharmacy offers both wholesale and retail pharmaceutical and over-the-counter products. We have the most competitive and affordable prices. We are the agents for Vit Plus multivitamin for healthy everyday lifestyle and Sanatogen powder. Hills and Valley Pharmacy supplies the best quality, name brand clinical products such as Rescue Oil, Bio Oil, Neutrogena, Aveeno, and Clarisil. We offer the most convenient opening hours. Our telephone numbers are 435-6904 or 6903. Remember, at Hills and Valley Pharmacy, your health is our business. We care.
Now open, Hills and Valley Medicare Center, your one-stop for medical supplies, massage therapy, physiotherapy, and an in-house physician. At Hills and Valley, your health is our business.
Good evening once again, folks, and welcome to Doctor on Call. We have been talking to you since last week, as a matter of fact, about the month of February being Cancer Awareness Month. And of course, last week, Dr. Nixon, she did a nice overview of what will be happening for the month of February here in Grenada. And one of the things she promised us was a very special guest that will be with us this evening, Dr. William Aiken. He is with the University Hospital. Of course, that's at the University of the West Indies. He's a medical doctor, a consultant urologist, and also lecturer in surgery. He's also the head of urology and DM urology supervisor at UWI, and that was between the year 2000 and 2014. Presently, he is the senior lecturer in urology at the University of the West Indies and consultant urologist. The list goes on. If I continue, we may not be able to start the program, so I would stop here for now. And let me first welcome Dr. Nixon. We're going to leave our special guest for last. So, Doc, good evening and welcome. Welcome back. Your microphone, Doc? Yeah.
Hi, good evening, and welcome to Dr. Aiken. I can't see you. You're hidden from view.
You're not seeing me? Oh, okay. All right. Let's see if we can have that sorted out. All right. Lovely, lovely, lovely. So it is my pleasure, folks, to welcome with us this evening, the first time on the program, Dr. William Aiken. Dr. Aiken, good evening and welcome to Doctor and Call.
Good evening. Thank you for having me. It's a pleasure to be here.
Well, it is really a pleasure to have you, and I think I can say welcome to Grenada.
Okay, I've actually been to Grenada before. It's such a beautiful country. In fact, it's very similar to Jamaica, mountainous and beautiful people. Yes.
Wonderful. Yes, we are indeed. Just as an aside, a lot of people believe that Usain Bolt has some Grenadian in him, right? That's why he's so good.
I thought it was a yam.
All right. But it is a pleasure. Well, it's Cancer Awareness Month, and Dr. Nixon has been really working with us in trying to put information out there so our people can understand what is involved. And our special focus this evening is on prostate cancer. But before we get into all of that, I would like us to put things into perspective. We hear a lot about prostate. How many of us really understand what it is? I'm not sure, but I believe after tonight's program we will. So, Doc, let us put it into perspective, explain what it is, its purpose, and then we would go into some of the complications with prostate.
Sure, I think that's an excellent place to start. So, there are some primary sexual organs. In the male, the primary sexual organs are the penis and the testis. The penis is the organ of copulation, and the testis is the organ that produces the sperm cells that fertilizes the female egg or ovum. There are some accessory sexual organs that provide a supporting role in male reproduction. And the prostate gland is one such gland. The prostate gland essentially has two main functions in sexual reproduction. It has a secretory function and it has a muscular, or what we call a sphincteric function. The prostate makes up approximately 20% of the secretions when a man ejaculates. So 20% of the volume of semen ejaculated originates in the prostate gland. The other 70% comes from an adjoining organ called the seminal vesicles, and only 5 to 10% of the semen is actually made up of sperm cells that originate from the testicles. This is why when a man has a vasectomy or ties off his tubes, there is no noticeable difference in the volume of semen ejaculated, because only 5% actually comes from the testicles or balls. So the prostate makes up 20% of the volume of the semen. And that 20% consists of some very important nutrients. It has very important enzymes or proteins. It has some very important substances which help to provide metabolic and nutritional support to the sperm cells in that long journey that they have to make in the female genital tract to the female egg to fertilize it. One of the substances actually secreted by the prostate that helps in fertilization of the female egg is a substance known as prostate-specific antigen, or PSA for short. And PSA is very important in fertility because it helps to keep the semen in a liquid and fluidic state so it can flow freely in the female genital tract. So that's the secretory function of the prostate. Of course, the secretions are rich in zinc. Zinc is a very, very important cofactor in prostatic secretions and the enzymes that are there and in terms of preventing infection. The other function of the prostate is a muscular one. When a man ejaculates, the muscle of the prostate contracts, and because of the anatomical arrangement of the prostate to the bladder, contraction of the prostate helps to prevent semen from going back into the bladder. So it helps to prevent what is called retrograde ejaculation. So during ejaculation, the prostate contracts, and this helps to prevent the flow of semen going backwards into the bladder. And so when a man ejaculates, that pulsatile, ejectile flow of semen is partly due to the presence of the prostate. So those are the two main functions of the prostate, very important in reproduction and fertility.
Okay, lovely. Dr. Nixon, I expect you to help me out here a lot tonight with some of the questions, since we are dealing with some heavy issues. So I will be relying on you quite a lot to step in from time to time and put some questions to Dr. Aiken. Yes. So, Doc, you mentioned something quickly there, retrograde ejaculation, and there's a lot to discuss, but perchance that happens. What is there anything serious with that?
No, retrograde ejaculation is not a serious problem. It is only a problem if a man is still interested in fathering children or impregnating his partner. In a situation like that, where you have retrograde ejaculation, and it may occur in persons who are diabetic, who are diabetic, and it's diabetes is affecting the nerves to the bladder, neck, and the prostate.
Okay, we seem to have a little issue there with our connection.
Yeah.
Dr. Nixon, you getting me clearly?
I'm just getting you back. I came back with you. I think Dr. Aiken is out. We might have had a big internet drop. Everything seemed to have gone for a second. Mm-hmm. We may have to ask him to link back in.
Yes. All right.
I think
he will.
You know, I think it's interesting that we get in a perspective out of Grenada, because West Indian men are basically West Indian men, and it'd be good to hear the research, which would be my question, because Dr. Aiken must be involved in a lot of research, and how the attitude generally, because we still have our men are kind of scared to go and figure out this thing, and I think the introduction he's given, that whole anatomical, physiological, structure and functional component, and that view of the prostate gland, because people wonder what a thing there for, right? Mm-hmm. If it's so far back, why you want to touch it, right? So I think given that view makes us see it differently as an integral part of the male anatomy and male sexual function, right? And why we should want to preserve it, and why we should want to make sure and check on it, and why we should want to make sure that we don't allow it to become cancerous by our lifestyle, or if it does, that we can treat it early and continue with our life. Because prostate cancer doesn't appear until a man is like about 40 plus. Hopefully by then you would have done as much reproduction as you want to do. Not necessarily all men, because a lot of us are postponing our family life because of careers, but not necessarily, not just our men, all men. And I think what he can afford will be of great interest to all of the men. The information he can share with us tonight will help us to understand why it's important to look at this. We've been losing our men simply because men. I saw one of our friends recently, a while ago, before we came on, who's a survivor, very personal, very private, but he speaks with his friends because he gets checked every year, right? And those are the things we want to be able to tell men why you can do this, so you can have the rest of your life. This is really a small part of your body that can become cancerous, which goes very slowly, that you can take care of, and that you can live after.
All right, definitely, and it's so important, and I think it's very, very, very urgent that men generally go and have themselves checked and have themselves screened. The point is, when you don't, and later on in life you realize, well, look, I probably have this, and then you start asking the, maybe I should have, or maybe I this and maybe I that, and it's too late then.
Yes.
Now is the time to do what you're supposed to do. Go get screened, and know where you are, know what your position is, so that you can deal with it. As you've always said, Doc, that this issue is one that doesn't. It's not rapidly spreading. It takes a while. So we have a little advantage with time, so you can go and do what you need to do and have it sorted out, So it's very important, men, and go have yourself check your family practitioner. You may have your doctor. You go talk to them and have it sorted out. You can visit Dr. Nixon. She's at the Bruce Street Mall, and have all of these things sorted out. We're hoping to have Dr. Aiken back. We seem to have had a major drop in the
in the internet.
Yes.
All of the internet went for a while.
Yes, indeed. Yeah. So hopefully he should be rejoining us shortly. Once everything goes well, we're looking forward to that, because there's a lot of information that we'd like to share with you this evening on this issue. Of course, on the backdrop of the month of February being Cancer Awareness. So it's very, very, very important. Doc, in the meantime, what are the possibilities of, let's say, a male under 40, having prostate cancer?
So a male under 40 will probably classify as an outlier. The people who lie way across the bell curve. Right? On either end, you would find mostly men over 40, men 40s, 50s, 60s. And we know that as men get older. Oh, I think Dr. Aiken is back on. We know that as men get older, the possibility is greater. Dr. Aiken, you're back.
Yes, I'm back.
All right. Yes.
The internet dropped for everybody.
Yes,
we had
it
internet
dropped.
as well.
Yes. All right. So,
you're just making up time. You're back on the floor. Thank you. Thank you for joining.
Yes, indeed. We're very happy. We're very happy for that. So, Doc, let's get into it. Prostate cancer. During what time in a male's life should they start thinking about the possibility that I could be developing prostate cancer?
Okay, prostate cancer is a disease of aging men. It is extremely rare.
Oh, we're all gone again.
We're not very lucky tonight, Doc.
I think we're all gone again.
We seem to be losing Doc.
It's coming back on.
It's
yeah.
Let's hope that we don't lose him again.
Well.
Right. In the meantime, I was asking him, Doc, about the at the age, and just before that, I had asked you about the possibility of someone under 40 contracting that condition.
And I can tell you, like I was saying in different words, basically you have a greater possibility of having prostate cancer as you age, right? So it's very rare that younger men may have prostate cancer. Not that they cannot, because they can. But the odds are very, very low that they would have prostate cancer under 40.
Okay. There was something he mentioned that I wanted to ask him about until he comes back. Let me throw it at you. The role of the prostate in ejaculation, because 20%, as he mentioned, comes from there. Excessive ejaculation. Can that put, let's say, some sort of strain on the prostate and down the line create problems? For example, he mentioned muscular and secretory, all right? Secretory, yes, I think I got it right. Muscular and secretory. That function, in the secretory function, can excessive secretion create a strain on the muscle, possibly weakening them and creating a problem for the prostate?
I don't know if I can answer this, but I'm going to try and be logical. So, in the muscular function is that of a sphincter, where it helps to propel. One, it helps that when there's an ejaculation and everything contracts and the secretions should go forward, right? They should go out through the urethra, which is right in front of the prostate gland, into the vagina for whatever function you do. It most likely we talk about procreation here, right?
Yes.
And the sphincter is like it contracts so that it doesn't go back. Because remember, intercourse is supposed to be for procreation.
Right.
So in the natural order of things, that's the way in which it will go forward. And that's muscular function. Now, whether that muscular, you're talking about a lot of muscular function,
Yes.
like hypersexual behaviors, I'm not sure. I really can't answer that. I'm sure Dr. Aiken will be a little more informed on me. Interesting, because Dr. Aiken, as a surgeon, I guess he sees men and to whom he will actually speak of prophylaxis, preventative behaviors, right? While on the other hand, he also sees men who already are ill. He already sees men who already have cancer and at different stages. So I think we have the best person. Plus, like I said, he's involved in a lot of research and maybe there's a lot he can share. Hopefully he can get back.
Yes.
But I guess we're born in the interim.
I really do hope so. And I really hope we can have this internet issue sorted out because, I do have a lot of questions for Dr. Aiken. I was all excited, and now the internet is giving us a very, very, very difficult time.
Run for our money.
Yes, indeed. So, Doc, well, you're going to have to take the questions in the meantime because the internet is playing games with us. Let's talk a little bit about maybe some of the early signs or symptoms that prostate is possibly stepping in. Prostate cancer.
So remember that, like in all forms of cancer, there could be no symptoms, especially in early signs. But a cancer grows, and the prostate is in a small space deep under the penis in the lower part of the abdomen, right? But it's around the urethra that the tube through which the urine comes out. Is right at the neck of the bladder, right? So it's in that space. If it continues to grow, it can cause you to have poor, elimination of urine. Okay? Because what it does as it grows out and it grows in. So you get stoppage of water. At first you might find that you have to push a little. And then you might find that even pushing doesn't happen. And you might also find that you have dribbling because you never really empty properly. So there's always a little bit that's left. And the excess, when your bladder fills, it will overflow and you have dribbling. And we see this in older men where there's dribbling and you might urinate yourself. Not necessarily a whole flow of urine, but some urine. And then you can have bleeding. You can have total stoppage of your urinary passage, so you can't go at all, right? Because there's total obstruction. This thing, one day, it's grown so much that it closes down. And of course, it grows and grows, and eventually what will happen to grow out of the abdominal cavity and create all the, invade the muscle, the organs around it, cause pressure on the ureters, the two tubes that come from the kidney with the urine. You can have backflow, you can have kidney failure, and of course it tends to spread through the bones for the most part, right? It can spread to abdominal tissue, but it tends to like to spread through bones. And I will tell you, I will never wish prostate cancer metastasis on anybody. It's probably one of the most painful things a male would experience, since he can't have babies.
Right. Okay.
It's very, 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 a lot of pain because remember, even the bones have their limits, right? With the periosteum, and when it gets back into if you expanded this bone, is growing, or the tumor is growing into the periosteum, which does not expand, you have a lot of nerve cells in there that become hyper excited and create a lot of pain. So those are the things.
Okay, wonderful. So, Doc, let's take our commercial break. Let's see if we can, join Dr. Aiken again, and then we'll be right back. Stay with us, folks. Don't go away. And we do apologize for that. We're having some internet issues, and we keep losing Dr. Aiken. So we'll be back in just a moment. Stay with us.
And Valley Pharmacy offers both wholesale and retail pharmaceutical and over-the-counter products. We have the most competitive and affordable prices. We are the agents for Vit Plus multivitamin for healthy everyday lifestyle and Sanatogen powder. Hills and Valley Pharmacy supplies the best quality, name brand clinical products such as Rescue Oil, Bio Oil, Neutrogena, Aveeno, and Clarisil. We offer the most convenient opening hours. Our telephone numbers are 435-6904 or 6903. Remember, at Hills and Valley Pharmacy, your health is our business. We care.
Now open Hills and Valley Medicare Center, your one-stop for medical supplies, massage therapy, physiotherapy, and an in-house physician. At Hills and Valley, your health is our business.
There is nothing good about jail. I don't want to be here.
My father told me that as far as he was concerned, I could stay in the home forever.
Our children deserve a chance for change. Children make mistakes, and child justice reform can help everyone to address these mistakes appropriately. Instead of sending a child to adult prison, let us give them alternative sentencing. We must divert our children from the court system through a holistic and systematic approach to addressing their offense and their road to rehabilitation. Rehabilitation helps child offenders to grow, change, learn from mistakes, accept responsibility, and make better choices. Reintegration of child offenders into the community after rehabilitation benefits the child, the family, and the community with a more productive citizen. Join the movement to give our children a chance for change. This message is brought to you by the USAID OECS Juvenile Justice Reform Project 2, funded by the United States Agency for International Development. For more information, log on to oecs.org/JJRP.
We support you at every stage of your life.
For business,
for your education,
for your financial freedom,
for that new ride.
Upgrade your life with the Communal. Contact us today.
Welcome back, folks. And again, let me apologize, but we have been able to make contact with Dr. Aiken. He's back with us. Doc, we do apologize for that. And, we hope things can go smooth from here on. I'd placed a couple of questions to Dr. Nixon in your absence just to make up the time. And there was one she really couldn't answer, so I'm going to put it to you now. You mentioned the two functions of the prostate gland, secretory and muscular. My question was, during the secretory function, can that put a strain on the muscular function and create problems for or with the prostate? In other words, men who are overly sexually active, excessive ejaculation, can it create a problem for the muscles of the gland and result in issues later on?
Certainly the muscles of the prostate can become sore, just like any other muscle in the body. If it is overused, it can become sore. But a man would really have to be ejaculating very often and very frequently to be overworking his prostate to the point where the prostatic muscle would become sore. We certainly, ejaculating is a good thing, and we know from several studies that men who ejaculate more often actually have a lower risk of developing prostate cancer later in life. So frequent ejaculation is a good thing, and we encourage men to have sexual intercourse with their committed partner because of a number of health benefits that accrue from sexual activity.
Okay, wonderful. Well,
you hear that? You hear that? Committed partner.
Well, I was about to emphasize that. Because that's very, very, very important. Promiscuous behavior is not at all a healthy thing. So, Doc, just before you fell off, I was asking also about the age. About what age can a man start thinking about the possibility of he might or could develop prostate cancer?
Okay, so let me be direct, because just in case I get dropped again, I want to get the information in. So the cancer societies and the Jamaica Urological Society certainly recommend that beginning at age 40, men start screening for prostate cancer. Certainly, Afro-Caribbean men and men with a family history of prostate cancer should start screening for the disease at age 40. If you are Caucasian and you don't have a family history of prostate cancer, you can begin screening at age 55. But for the vast majority of us who are of Afro-Caribbean descent, age 40 is the age that we recommend starting screening, because prostate cancer is a major public health problem in the Caribbean. It is the number one cause of cancer deaths in the Caribbean by far. And so if we want to make an impact on the death rate, we need to start screening men beginning at age 40 years.
Right. Men tend to be, we are the macho type. We think that we can handle everything, and generally, man, I'm okay. I'm good. I don't need to go check. I'm all right. I'm going to be okay. There's no prostate. There's nothing. What would you say to men like these?
Okay, so I would say those men are living in a fool's paradise. Let me be clear. Early prostate cancer does not cause any symptoms whatsoever. So a man will feel perfectly fine, and there's a cancer growing inside of him in his prostate. And it is not until that prostate cancer is advanced, either locally advanced or it has metastasized or spread to other parts of the body, that it will start producing symptoms. So if a man thinks that just because he feels okay, he is well, then he really is living in a fool's paradise. There are a number of cancers, including prostate cancer, that produce a high death rate by virtue of the fact that when they're early and they're therefore curable, they do not produce any symptoms, generally speaking. And when they do start producing symptoms, the cancer is advanced and no longer curable. So those men are then marked for death from the disease. They are ultimately going to die from the disease, and that would have been a completely avoidable death. Completely.
Mm-hmm. Right. Had they done the screening and picked it up early?
Absolutely.
Right. What causes the prostate to start growing and to become that way, resulting in a cancer?
Okay, so that's $1 million question. We know that all men, there are three diseases that affect the prostate. There is what is called benign prostatic hyperplasia, which is benign or non-cancerous enlargement. There is prostate cancer, and there is a condition known as prostatitis, which is an inflammation of the prostate. Both benign or non-cancerous enlargement of the prostate and prostate cancer are diseases of aging men. So as men get older, their likelihood of developing an enlarged prostate as well as prostate cancer increases with age. Now, BPH, the non-cancerous enlargement, tends to cause symptoms early. These men, because the prostate surrounds the urethra at the bladder neck, and because the part of the prostate that undergoes a benign or non-cancerous enlargement immediately surrounds the urethra, men with BPH or benign enlargement, they will tend to get symptoms early. So these symptoms include things like getting up to pass urine at night, not being able to hold the urine, going often during the day, taking a long time to start the flow of urine. The urine comes out very weak, and then feel like they haven't emptied their bladders. These are all symptoms of benign or non-cancerous enlargement. Prostate cancer tends not to cause any symptoms when it's early because it's in the peripheral part of the gland. It's not in the part that immediately surrounds the urethra. Why do men get prostate cancer and BPH as they get older? We don't exactly know why. We do know that age is definitely a factor. Prostate cancer and BPH do not occur in young men. We know that men of African ancestry are at higher risk for prostate cancer. And we know that if you have a family history of prostate cancer and indeed breast cancer, you are at greater risk of developing prostate cancer. It may well be that in terms of benign or non-cancerous enlargement, the hormonal changes that take place in a man's body as he ages precipitates the growth of the prostate. As a man ages, his testosterone level falls and the female hormone level relatively rises. And so there is a change in the ratio of male to female hormones. And it is felt that this may be one of the tipping points that causes growth of the prostate. But all men, if they become old enough, will develop benign or non-cancerous enlargement of the gland. A lot of men too will develop prostate cancer, but prostate cancer is not a homogeneous disease. Some cancers are very aggressive and will result in death. Some cancers the men will have to a ripe old age and die with the cancer. And so the job of the doctor is to try and differentiate between those cancers, the ones that are aggressive, and treat those aggressively, and the ones that will not affect the man, to leave those alone and allow the man to live to a ripe old age with his cancer that he won't die from. So it's important to make that distinction. Not all prostate cancers are the same. Some are aggressive and need to be identified and treated. Others should be left alone.
What about the issue of obesity and prostate? Is there any relationship, any connection there?
So obesity is linked to 11 cancers in terms of causation or a contributing factor. Obesity per se is not a cause of prostate cancer, but what we have found in many studies, including ones done in Jamaica, is that if a man develops prostate cancer and he is obese, if he has a large waist circumference, especially what we call centripetal obesity, or that fat around the waist, that tends to make the cancers more aggressive. And these men are more likely to die from their prostate cancer compared to men who are not obese.
Okay. The issue of erectile dysfunction and the prostate cancer. The connections.
Okay.
Yeah. Mm-hmm.
So it's a complex connection, and so let me explain. So prostate cancer is not a cause per se of erectile dysfunction. But one of the things that can happen to a man when he is diagnosed with prostate cancer and he begins to worry and catastrophize about the disease, the brain is the most important sexual organ in the body. And if a man is anxious and worried and depressed about his diagnosis, that certainly can adversely affect erections. The treatment of early prostate cancer involves either removal of the prostate or radiotherapy for the prostate or depending on how aggressive the cancer is, in some cases just monitoring the cancer closely. Both removal of the prostate and radiotherapy to the prostate may be associated with erectile dysfunction. There are two nerves that, a pair of nerves that supply the penis that are very intimately associated with the prostate. And these nerves need to be carefully identified and dissected off the prostate at the time of surgery to preserve them. But even when you preserve these nerves, just the trauma of dissecting these nerves may result in a transient loss of function of these nerves. So it is important for men to know if they're going to have surgery to remove the prostate, that they may transiently develop erectile dysfunction. Now, the radiotherapy, which is another treatment option, tends to cause erectile dysfunction a few years after treatment. So 3 to 5 years after treatment, approximately 50 to 60% of men who have had radiotherapy may develop erectile dysfunction. And this is because one of the things that radiotherapy does is that it narrows blood vessels. And erections depend on an adequate flow of blood into the penis for you to have a normal erection. So as these blood vessels become narrowed from the radiotherapy given 3 to 5 years earlier, the man may develop erectile dysfunction. Let me hasten to add, though, that when men have advanced or metastatic prostate cancer, the treatment for that is hormone therapy. And that hormone therapy involves suppressing the production of testosterone by the man's body. And therefore, almost 100% of men with advanced cancer will develop erectile dysfunction when treated with the hormone therapy. Whereas if you have early prostate cancer, if you have picked it up early, and for example, you have had surgery and the surgeon was able to spare the nerves, that man will fully recover his erections. So it is better to discover the prostate cancer early and have a significant probability of your nerves being spared and being able to have erections after treatment, rather than discovering the cancer late and needing hormone therapy, which is almost certain to cause erectile dysfunction.
Okay, wonderful. Dr. Nixon, you want to pop in here with anything for Dr. Aiken?
Yes, I wanted to ask, because I know you do a lot of research.
Sure.
Yes, and unfortunately, we don't do a lot of research here in Grenada, but give us an idea as to the demographics. I wanted to tell you something first, though. So you talk about Caucasian men, right? But even Caucasian men in the Caribbean may not be 100% Caucasian men, because you know our granny and our grandfathers, what they did and all the rest of it. So maybe would we, first of all, and we should encourage all our men to do their screening anyway at 40, because you don't know who you really are, right? Because of the mix-up. And tell me about what research is showing with the trends, and certainly in Jamaica and whatever you have for the Caribbean, which I'm sure can be extrapolated to Grenada, as per trends in prostate cancer.
Sure. So, we in Jamaica just recently developed our guidelines. The Ministry of Health recently developed guidelines for non-communicable diseases, and prostate cancer being one of them, the most common cause of cancer deaths. That's one of the diseases we focused on. And certainly we did not really make a distinction between Caucasian men, because as you quite correctly said, first of all, we're perhaps 97% of us are of African descent, and so many of us are mixed with so many different, there's so much admixture in the Caribbean that to differentiate between Caucasian men and men of African descent would probably not be an important distinction to make. So you're right. I think, the statement that men should screen at age 40 should apply for all men in the Caribbean. The question about research and demographics. So one of the things that a lot of Caribbean people may not know is that up until 2 years ago, the Caribbean had the highest mortality rate in the world from prostate cancer. We had that dubious distinction of having the highest mortality rate. And this just speaks to the serious public health problem that prostate cancer poses. Well, within the last 2 years, sub-Saharan Africa has overtaken us with a higher mortality rate. And so they have relegated us to the number 2 position now in terms of cancer deaths from prostate cancer. But this still speaks to the importance of screening and trying to decrease the death rate from prostate cancer. You see, one of the things, Dr. Nixon, is that you can manipulate figures in terms of the incidence of prostate cancer based on the degree of screening in the population. And so you have countries like Guadeloupe and Martinique and Saint Martin, these French departments where they do a lot of screening, and you'll find incidence rates of like 180 men per 100,000, whereas in Jamaica it's about 78 men. In Barbados it's 80 odd men, I believe. And so these incidence rates fluctuate widely based on the level of screening. But it is the death rate from prostate cancer that gives you a real public health, the public health burden of the disease in our population. And countries, like Jamaica, Barbados, Grenada, Trinidad, the Bahamas, they have extraordinarily high death rates from prostate cancer. It is true that if we screen more, then the death rates will come down. And so countries like Martinique and Saint Martin and Guadeloupe that do a lot of screening, their death rates are actually significantly lower than the other Caribbean territories. But of course, it comes at the high cost of screening. And so this is an important point that we need to make, because the only certain way to prevent prostate cancer is through secondary prevention. Unfortunately, there's no primary prevention of prostate cancer through diet or lifestyle that has been proven to work. In other words,
can you explain the whole thing of primary prevention and secondary for the interest of the population?
Right. So secondary prevention includes things like screening, where you try to detect a disease early before it causes symptoms, with the hope of detecting the disease at an early stage so that you hopefully can cure it. Things like vaccination and screening are secondary prevention. Primary prevention refers to things that the individual can do, things like diet and exercise, to prevent the onset of the disease in the first place. And although there is some evidence that diet is important in the prevention of prostate cancer, it is not a guarantee. In other words, a man can eat all the healthy foods. He can avoid eating red meat and processed meats, which are known to be associated with prostate cancer. So let me repeat that. Red meat and processed meats, as well as a lot of animal fats, are all associated with prostate cancer, dairy products as well. So a man can avoid eating all of those and eat a diet rich in fruits and vegetables, different colored fruits and vegetables. He can exercise regularly, maintain an ideal body weight, not smoke, and he can still develop an aggressive form of prostate cancer. So it is through screening by doing a blood test called a prostate-specific antigen test. We spoke about PSA earlier. PSA is a small protein that's produced by the prostate and secreted by it. And we said earlier that it liquefies semen. But whenever anything is wrong with the prostate, not just prostate cancer, whenever anything at all is wrong with the prostate, it leaks into the bloodstream in increased quantities. So we use this PSA test to determine if there is anything wrong with the prostate. And let me hasten to add that a high PSA does not necessarily mean that you have prostate cancer. Riding a bicycle will send your PSA sky high. Having a urinary tract infection will send your PSA sky high. having stoppage of water, if not being unable to pass urine, suddenly will cause your PSA to go up. Even something as simple as having sex and ejaculating will cause a slight increase in your PSA. So it's not the PSA being high itself that means that you have prostate cancer. It simply means that there's something wrong with the prostate, and we need to do further confirmatory tests to determine if you have cancer. So the PSA test is one of the tests that we do. Of course, the other test is the digital rectal examination, where the doctor inserts his or her gloved, lubricated finger in the rectum. Because of the anatomical relationship of the prostate to the rectum, the prostate is immediately in front of the rectum. And fortuitously, the part of the prostate called the peripheral zone, where 70% of the cancers arise, that is adjacent to the rectum. So when the doctor puts his or her gloved and lubricated finger in the rectum to feel the surface of the prostate, essentially they're feeling to see if the prostate feels like the tip of the nose. It should have a firm, rubbery consistency. If we find that the prostate feels like our knuckle, if there's any hardness or what we call induration, or if there is loss of springiness of the prostate or the grooves are lost, then all of that would lead us to suspect that cancer may be present. And then we would confirm that with what is called a biopsy, where we take tissue or small pieces of tissue from the living body, and we send it to the pathologist, who will process the tissue and look at it under the microscope and tell us whether or not cancer is present. So this is what we need to do more of to prevent deaths from prostate cancer, unnecessary deaths from prostate cancer in the Caribbean.
Okay, excellent. Now, in terms of the stages of prostate cancer, let's talk a little bit about that. How do we grade it?
Okay, so grade and stage are two different concepts. So the grade of a cancer speaks to the level of aggressiveness of the cancer, and this is something that the pathologist will report when they are reporting on the diagnosis from the tissue. They will report on the grade or the level of aggressiveness of the cancer. The grade of the prostate cancer is known as the Gleason grade, and it's from 6 to 10, with 10 being the worst grade, 6 being the best possible grade. So we call the 6 a Gleason score, and the 10 is, as I said, is a worst possible score. The stage is really related to the extent of spread of the disease. So whenever we speak about stage of a disease, we're referring to the extent of spread of the disease. And the stage is really determined by tests that are done, simple tests like the rectal examination we mentioned earlier, as well as an MRI, a multiparametric magnetic resonance imaging test, which is a special imaging test to visualize the prostate. We can do what are known as bone scans to see if the cancer has spread to the bone. The bone is one of the places that the cancer spreads early, as well as the lymph nodes. So the bones are involved early when the cancer spreads. So we do the bone scan in certain patients to determine if the cancer has spread there. So these are some of the staging tests that are done to determine the extent of spread of the disease.
Okay, wonderful. I want to move quickly to the advanced symptoms. So, yes, someone experiencing some mild symptoms with urine and little blood and so. But when it gets to an advanced stage, what are some of the complications that are involved?
Okay, so as the cancer advances, one of the things that it will do, just like BPH or the non-benign or non-cancerous enlargement, it may start to compress the urethra. So the man may notice that he develops difficulty passing urine. It may take a long time for him to start urinating. The urine may come out very slowly. He may have to strain to pass urine, and he may have a feeling after urinating that more urine is left behind in the bladder. He may also start getting up at night and going more often, both in the night and during the day, to pass urine. And it's generally small volumes of urine, as opposed to somebody who is diabetic who passes large volumes frequently. Here it's small volumes of urine being passed frequently. The man may also notice blood in the urine or blood in the semen when he ejaculates. His legs may start to swell, so he may notice swelling of the legs because the cancer may be obstructing the veins or involving the lymph nodes in the pelvis that causes blood to back up or lymphatic lymph flow to back up in the legs, so his legs may become swollen. He may lose his appetite, and he may find that he is now losing weight. He may also develop back pain or pain in other bony areas, such as the rib cage or the shoulders. And so these are all symptoms of advanced prostate cancer, advanced and metastatic prostate cancer. As the disease progresses even further, if it starts to compress the spinal cord, the man may lose power in his lower legs, and he may become paraplegic and be unable to walk. The other thing that may also happen is that he may develop kidney failure, because as the cancer advances, it blocks the tubes that carry urine from the kidney to the bladder. And so urine backs up in the kidneys. It cannot enter the bladder, and it backs up. The kidneys are responsible for removing waste products from the body and excess body fluid. So the person develops full-blown kidney failure as a result of the prostate cancer. So it's a pretty awful cancer to have, because you may end up becoming paraplegic, you may end up with kidney failure, not to mention the pain and suffering from the metastases to the bone. And all of that is preventable with screening. All of that is completely preventable.
Right. One question before I bring in Dr. Nixon as well. Is there any relationship or connection to other chronic conditions? Let's say, for example, hypertension, diabetes, with prostate cancer?
That's a very good question. So the short answer is no. We have not noticed, our research has not found any connection with other diseases. There are other diseases in the urinary tract. For example, kidney cancer is associated with hypertension and cigarette smoking and obesity. But no, we haven't found any connection with prostate cancer. There are some studies that have suggested that diabetics are maybe a slightly more at risk of developing prostate cancer, but these studies are not robust. They have essentially given a suggestion, and it requires further research to determine if there is a real association between diabetes and prostate cancer.
Okay. Dr. Nixon?
Yes?
You need to come in.
I've been here all along.
Okay. So, Doc, another question. STDs and STIs and prostate. Can any of these maybe lead to prostate or create conditions that can affect the prostate?
So a lot of research has been done looking at the association between sexually transmitted infections and prostate cancer. In the early days, when a lot of what we call retrospective studies, which are generally not as robust as what we call prospective studies, where you go forward in time. A lot of older retrospective studies suggested an association between STIs like gonorrhea and prostate cancer. But as more studies were done, and especially prospective studies, which give a higher level of evidence, there were no associations found between things like gonorrhea and prostate cancer. There are other STIs that have been looked at as well, particularly human papillomavirus, and I think the jury is still out. There are some studies that suggest a connection, whereas others don't. But all in all, the overwhelming weight of evidence suggests so far that there is no robust link between any of the STIs and prostate cancer at this point in time.
Okay, excellent. Now, folks, the time has moved on to just about 24 minutes under the hour of 10 o'clock. Our telephone line is now open. The number is 435-2041. If you have any questions, and you should have, Dr. Aiken is here, Dr. Nixon is here, and they'll be more than happy to assist. So the number again, 435-2041. Let's go to our telephone. Dr. and Call, good evening.
Yeah, good night.
Yes, good evening. Go ahead, please.
I would like the doctor to tell me, if the number, if the prostate cancer is very prevalent in people who are vegetarian. Thank you.
Thank you, caller. Doc, he's asking if the prostate cancer, if it's prevalent in people who are strictly vegetarian.
Okay, very good question. So, studies have been done in places like Loma Linda, where they have a community of seven Seventh-day Adventists. Right. And Seventh-day Adventists usually have a very healthy diet. They don't eat a lot of things, like certainly they don't eat pork, they don't eat, a lot of them don't eat red meat, and they don't eat a lot of other, and drink a lot of other beverages that we regularly consume. And it has been found that in places like Loma Linda, the incidence of prostate cancer and certainly death from prostate cancer is lower compared to other places. So there does seem, and as I said earlier, there is some degree of evidence that diet does play a role in prostate cancer. We know that persons who migrate from low-risk, low incidence countries such as China, Japan, and so on in Southeast Asia, that when they migrate to the US and adopt a westernized lifestyle, that certainly within a generation, their incidence approximates that of a Native American. So they obviously take their genes with them. The only thing that has changed is their diet and lifestyle. And so there does seem to be something in the diet that increases your risk of prostate cancer. And certainly the things that have been suggested, such as red meat, animal fat, processed meats, things like bacon, salami, bologna, sausage, all of those meats that are processed, anything in a plastic wrapper, these things appear to increase your risk of prostate cancer.
Okay, thank you. Let's go back to our telephone. Doctor and Call, good evening. We seem to have lost that call. The number again, 435-2041. Let's try again. Doctor and Call, good evening.
Yeah, good night to the doctor, to both doctors, and to yourself. I want to ask and then make a comment. Can you tell us whether the issue of heat is associated with cancer? I'm totally leaving me now. The cancer we're speaking about,
prostate.
That prostate, based on heat, like the tightness of the underwear, it is said that one of the reasons that when we were young and we were told as boys not to sit down on hot stone is one of the ways of avoiding that kind of situation. Can you speak to that? Also, the Sahara, South of Sahara, overtake the west of the Caribbean. I learned previously that Caribbean had a higher incidence than the than the African people on the continent because of the kind of way we defecate. We sit on a toilet, where the African, they squat. Is there any connection with that? And finally, can you explain to people, because we assume everybody understands, what is really a cancer? And because people have all kind of weird idea was a cancer, so that at least can bring home the issue to people. And I say finally, can you? Would it be better if we help people from young to take responsibility for how life occurs to them, so they wouldn't have to wait until 40 to be concerned about whether they have a prostate or other illnesses? Wouldn't it be better for us to teach people to take responsibility for the whole of their life, psychologically, in all aspects of their life? Thank you very much for your indulgence.
Thank you very much, caller. Thanks a lot indeed. Doc, were you able to get all the questions?
Some of them, not all of them. I heard one about heat.
Yes,
So heat adversely affects sperm production. The reason the testes are placed in the scrotum or seed bag is so that it's away from the body. So the testicle is actually kept at a lower temperature compared to the rest of the body. Whenever men wear tight underwear or they work in an environment where there's a lot of heat, like in kitchens, this can adversely affect their sperm production. But I am not aware of any association whatsoever with prostate cancer. Okay, so I heard that first question. I hope you're able to tell me what the other question.
The other one he was asking about, he was making a connection with Caribbean people of African descent and actual Africans, and was questioning the manner in which we defecate, whereas Caribbean people sit, and he's claiming that Africans squat. Is there any connection with that and the prostate?
So again, I'm not aware of any study that has looked at that, but from a biological and physiological point of view, I couldn't see a connection. I could understand if he was suggesting that there may be a link with rectal cancer, but the prostate is totally disconnected from the digestive tract, and so I cannot see how the manner in which we defecate could affect the health of the prostate.
Okay, let's go back to our telephone.
No, don't go yet, because he actually raised another point about the way about us waiting until it's time to screen, and he made a very important point about our lifestyle from young and ensuring that everybody is prepares not to have a cancer by the way we live. Recently, there's been a trend, or we've tried, or it's being tried, to remove sugar-sweetened beverages from school, right? The Ministry of Health has said so. There's the national school feeding policy speaks to the way our children eat in school, having new menus for our children to eat healthier. And so it's a very important point that he's raised, because part of the reason we talk about obesity being a predisposing factor to many kinds of cancer is actually considered a high-risk factor to a lot of the cancers that we see now. So I think it's a very important point that we need to consider. A lot of parents get upset when they say we're not going to have sugar-sweetened beverages in school. Our children spend most of their awake hours and the active life during those 8 hours at school. Now they're at home, and we hope that the behaviors are similar. So it's really a good point to bring here that we should start preventing disease from our children. When we talk about childhood obesity, we have seen a growth in childhood obesity by 6% every year in our children. That's not a good sign. We've seen that parents of chronic diseases like diabetes occurring much, much earlier. So the diabetes that your granny used to have, now your grandchildren having it. 13, 14-year-olds with adult onset type diabetes. So his point is really valid. And as Dr. Aiken says here, we see that the people at Loma Linda's people even though they treat cancer down there, the Loma Linda people, the people in Loma Linda have been a big research group for a long time, especially in relation to lifestyle and chronic diseases. And we have seen that because they eat differently from us, they really very even style in the way they eat, that they haven't had cancers, they have lower incidence of chronic diseases. The other thing is, Dr. Aiken, do you remember the whole issue of, you spoke to a lot of the preserved foods, and the whole issue of nitrites being potentially carcinogenous? Yes, we eat a lot of sausage. Yes, we eat a lot of ham. We eat a lot of salami. We eat a lot of bacon and a lot of preserved food. And in Grenada, we eat a lot of, this is carnivore, this has just been independence. We eat a lot of corned meat, pigtail, salt beef. Oil long is our national dish. There's no oil long without corned meat. So the truth is, we need to start pinching ourselves and start preparing our children, especially, like you say, in families where there is a higher incidence of prostate cancer, right? We need to start ensuring that our children adopt healthy lifestyles.
It's an important point, because from the time a cancer is initiated to the time it becomes clinically detectable is about a decade or more. And it is the choices that we make in our diet and lifestyle 10 years, 20 years before the potential onset of a cancer that will determine whether or not we suffer from these diseases. So the choices that we make today in terms of our diet and lifestyle will determine the diseases that affect us a decade, 2 decades down the road. And so the point is a valid one. I think the gentleman wanted to know as well, if I'm correct, what was a cancer. I think he may have. Yes. Right. So the human body is made up of trillions of cells, and these cells arrange themselves into different organs, and organs come together and form different systems. Well, the cells that make up the body, they exist in harmony with each other. There is never a situation where there's an excessive production of one type of cell. And the regulation of the growth of these cells so that they exist in harmony is based on the genetic makeup of the cell, as well as hormones that are secreted by the cells that act on the cells themselves and act on other cells in their environment. And they may even act on different organs via the bloodstream, what we call hormones. Now, if you have a genetic alteration in or makeup of a cell that causes it to bypass this regulation in its growth, and that cell now grows in an abnormal and excessive fashion, then that is the beginnings of a cancer. But a cancer really is characterized by the ability to invade adjacent tissues and ultimately to what we call metastasize, where it breaks off from its parent or source organ, accesses the lymphatic channels and the bloodstream, and can then travel to distant sites in the body and take root there. So it's this ability to invade and tissues directly and to metastasize that characterizes a cancer and differentiates it from what we call a benign tumor. And ultimately, a cancer is a parasite. It will continue to grow at the expense of the host until the host actually dies, or until the cancer grows to such a point that it outstrips its blood supply and then it dies. But ultimately, most cancers, if not detected early and adequately treated, will cause the host to succumb because it is a parasite. It diverts all the body's metabolic nutrients and so on to itself at the expense of the host. So that's what a cancer is. It's an abnormal growth that continues to grow in an excessive and abnormal fashion until it ultimately causes usually the demise of the host.
Okay, let's go back to our telephone. Dr. on call, good evening.
Are there any medication to reduce the emerald prostate?
Okay, thank you. The caller is asking if there's any medication that can address this issue of prostate.
Yes, there are many drugs on the market to treat what we call benign and benign prostatic hyperplasia or BPH or prostate enlargement. There are drugs that relaxes the muscle of the prostate and decreases the resistance to the flow of urine, so the bladder is emptied more efficiently. There are drugs that decrease the size of the prostate in benign prostatic hyperplasia. And these drugs actually have a side effect where they decrease the risk or likelihood of prostate cancer by about 25 to 30%. However, they are not FDA approved primarily for that purpose. Their primary purpose is to reduce the size of the prostate gland. Although, as I mentioned, they actually reduce the risk of prostate cancer as well. So there are those drugs, as I said, that relax the prostate. There are those that decrease the size of the gland, and those are given for BPH or non-cancerous enlargement of the gland. And then there are drugs to treat advanced prostate cancer and metastatic prostate cancer when the cancer has spread. As we mentioned earlier, in the old days, we used to remove a man's testicles. And in fact, it's still done in many parts of the world, including the Caribbean. We removed a man's testicles, the source of testosterone, or the main source of testosterone. And no matter where the cancer was in the body, the cancer would shrink and remain in that shrunken state for a variable period of time. Fortunately, we no longer have to remove a man's testicles. We can now give various drugs that will suppress the production of testosterone by the man, and these drugs cause the cancer to shrink no matter where in the body the cancer is. So there are a whole host of drugs now to treat prostate cancer. One of the things that may eventually happen as a cancer, as time passes, is that these drugs that suppress testosterone, the cancer may stop responding favorably to these drugs. And then you'll have to give the man additional medication, including chemotherapy, to get a continued response from the cancer. So there are a whole host of drugs to treat both benign prostatic hyperplasia or benign enlargement, as well as advanced and metastatic prostate cancer. As we said for early prostate cancer, the mainstay of treatment is either to surgically remove the prostate or to give radiotherapy or high energy radiation to the prostate, or in some cases where you diagnose what is called low risk or very low risk prostate cancer, we simply monitor the disease very carefully and only treat if the cancer shows signs of progressing.
Okay. Let's go back to our telephone. Dr. Ncole, good evening.
Yeah, Doc, I heard you mention a lot about treatment. But I was thinking, the things are small and I'm hearing about cancer. Was it unwise for me to define or interpret like cancer, like a condition of the body, a physical condition to which there is no definite cure? Because I only hear you talking about treatment, but there seems to be no definite cure, and that is what I say in defining what a cancer really is, or cancer situation. Well, I'm listening. Thank you.
Thank you, caller. He's making reference to a definite cure for the condition, Doc.
Okay. So both surgery, if the cancer is discovered early when it's confined to the prostate, as well as radiotherapy, can actually cure men from prostate cancer. So both there's the surgical cure and there's a cure from radiotherapy. As I said earlier, some men don't need to be cured from prostate cancer because the cancer is not going to cause a problem in their lifetime. They will die with the cancer and not from the cancer. So in some cases, men actually don't need a cure for prostate cancer. Now, is there a cure for the cancer once it has metastasized or spread? The short answer to that is no. I am not aware of any study anywhere that has shown that you can cure prostate cancer once it has metastasized or spread to other organs or other sites in the body. That is considered an incurable situation and ultimately is terminal. It's a terminal disease.
Mm-hmm. Let's go back to a telephone again. Doctor on call, good evening.
Yes, trying to get doctor on call.
Yes, go ahead, please.
Doctor, pleasant night to you and your panel. Well done, Doc. Very good explanation of the prostate. Very good. I just hope that the people, the men itself, will take into consideration and take your total advice with along with Dr. Nelson. I must say that the 14th of this month, I will be 16 years free of cancer.
Very good. Very good. Very good.
Thank you very much.
Thank you very much, caller. Good news for this patient indeed. 16 years. That's a long time. Yes.
I wanted to make a point here, and I'm happy that this man called and did his testimony. 16 years is a long time. 16 years is only a long time if you're diagnosed early. So you only have 16 years if you do, as Dr. Aiken suggested, if you have secondary prevention. Yeah, lifestyle is there, but you have to be looking to make sure it's not there. And if it's there, to capture it very early, as you don't have 16 years.
Okay.
That is what I understand. The other thing is, Dr. Aiken mentioned that in treating, if it's not an aggressive form of cancer, you can have surgery and you're fine. However, if it's an aggressive form, what we find is that men would need radiotherapy, as he said. We don't have radiotherapy in Grenada. Radiotherapy is expensive, one. It's not available in Grenada, two. And there's a thing called COVID out there that's keeping us from moving where we want to go. No hospital wants you to come there because they don't know what you're bringing. Okay? We also know that people who have diseases like cancers are more prone to becoming infected by the virus and dying as a result of having contracted the virus. So all of these things, we don't know how long coronavirus is going to be around. There's talk about the vaccine, but there's talk about there's all kind of talk about vaccines and stuff. That's not our only way out of COVID. The bottom line is that COVID is with us, and it is hampering a lot of the treatment that people should be accessing. We can't go to Trinidad, whereas where we went. The other place is Martinique. Can't go to Martinique either, the doors are locked. Go to the US, we probably can't afford it. Go to Antigua, the door is probably locked, which is where the Caribbean Center is. So we really need to focus a lot on primary and secondary prevention to ensure that people are not ill when they're diagnosed.
Thank you very much. Yes. Mm-hmm. So let's take our final call because we're almost out of time. Doctor on call, good evening.
Good evening.
Yes, good evening. Go ahead, please, caller.
I want to know what is really acid reflux and what causes you get from acid reflux. Thank you.
Okay, thank you, caller. Well,
that's a question for Dr. Nixon.
Doc.
That's a question.
Doc, your mic is muted. Dr. Nixon, your microphone is muted. Yeah.
No, we lost a lot of time tonight. I wish you could just focus on this very important point. I can always answer this question to the gentleman another time. He could call me on my phone and ask me the question. I'll be with him. It doesn't really matter. Okay.
Right. So quickly, Dr. Aiken, before we wrap, we've discussed quite a lot. And I would definitely like to have you back sometime soon, because we did lose some time, and I'm sure there's a lot more we can talk about as it relates to prostate. So I'd like to have you back. That's an open invitation. But before we go, someone living with prostate cancer, let's just because that's a very important part of it. We're talking about the patient. He has prostate, he's in pain, he probably doesn't have the kind of monies to get the treatment that he requires. He has a family who has to look after him and all of that. Let's talk a little bit about that before we wrap.
Okay, so earlier you asked about the stages of prostate cancer.
Mm-hmm.
The treatment of prostate cancer is very much according to the stage of the disease, the age of the patient, and the life expectancy of the patient. Very important. And of course, the patient's wishes and what is available, what treatment options are available to that patient. If it is early prostate cancer, and all treatment options are available, the patient really has, and the patient is in good health and has a long life expectancy, the patient is really looking at surgical removal of the prostate or radiotherapy to the prostate. If it's a low-risk prostate cancer, then they simply need to be doing their very close monitoring called active surveillance, where a doctor will check their PSAs regularly, do their rectal examinations regularly, and repeat biopsies at intervals just to make sure the cancer is not progressing. And as I said, this is, for some men, this is all that is necessary because there's what is known as over-treatment of prostate cancers. Not all men are destined to die from prostate cancer. So for those men who have low-risk disease, they don't need to be aggressively treated right away. They can have this active surveillance. If the cancer is locally advanced now, so if the cancer has spread beyond the confines of the prostate, but it hasn't spread to distant sites in the body, a combination of radiotherapy, which we just heard is not available in Grenada, and hormone therapy for 3 years is a treatment of choice for that. And it can be cured. Locally advanced prostate cancer can be cured with a combination of hormone therapy and radiotherapy. When the cancer metastasizes and spreads, then you have a number of options for treatment there. Prostate cancer is what is called a hormone-sensitive cancer. It depends on the male hormone testosterone to continue multiplying and growing and spreading. So depriving that cancer of testosterone will cause it to what we call involute or shrink, and it will remain in that shrunken state for a variable period of time. For those men who are economically challenged and do not have the resources to afford a recurring medication to suppress testosterone, surgical removal of the testicles is the best option for them because it's a one-off treatment, and ultimately it will be less expensive than having to go to the doctor every 3 months or every month to get an injection. For those men who can afford it and who are concerned about the quality of life and not wanting to lose their testicles, there are options for 3 monthly or monthly injections of various drugs that can suppress the testosterone. And we know that men respond to this for a median period of up to 2 years. After 2 years, you may need to give additional medication because the cancer learns how to circumvent the low testosterone and start growing again. And when this happens, you need to give additional treatment, or you may need to give chemotherapy. Sometimes you may need to involve a medical oncologist at this point in time. And essentially, this phase of the disease called castration-resistant prostate cancer is a terminal phase of the disease. Most men are dead within 3 to 5 years of developing this castration-resistant prostate cancer. Now, I hasten to add that compared to a cancer like pancreatic cancer, where typically you're dead within 3 months of the diagnosis, with prostate cancer, there are options. Even when it has spread, even when it has metastasized, most men will respond to the initial treatment of hormone suppression. And I've seen patients respond to up to 7 years before needing additional medication. But as I said, the median response time is about 2 years. and then additional medication, especially medications that have become available within the last 2 to 5 years, you can get an additional 5 years of life with these medications. But ultimately, castration-resistant prostate cancer will take your life.
One final question someone is asking. He says some persons may have a low PSA, but the prostate may be enlarged. Does this mean that the person will eventually develop prostate cancer?
No, not at all. Remember, we said that there are 2 diseases that affect aging men, the non-cancerous enlargement and prostate cancer. So it's quite possible for a man to have an enlarged prostate and have a low PSA. The PSA rises higher relative to BPH in prostate cancer. So prostate cancer will cause a relatively higher increase in your PSA compared to BPH.
Right.
But
and
both of them, but both of them may cause a rise in your PSA. That's an important point.
All right. And final question, Doc, I don't know how it is in Jamaica, but in Grenada, there are many among us who believe in what we call the bush, the herbal medicine. Someone is asking me if drinking zooty. Doc, I don't know if you're familiar with zooty. It's a vine that causes the skin to itch a lot.
Kind of like stinging nettle.
Right. Okay. Yeah. Someone is asking if drinking that can cure prostate. I don't know if you can answer as it relates to the use of herbal medicine.
So what I can tell you that in Jamaica it's the same. We did a study. We found that 60% of men who were diagnosed with prostate cancer were taking natural home remedies. The most common one being what is known as guinea hen weed, which is the most common herbal or natural product used. So it's very similar in Jamaica to Grenada, although the actual herbal product may be different. As I said earlier, there is no scientific evidence to date that any of these things cure prostate cancer. They may inhibit them in the lab, but certainly from the point of view of developing any sort of therapeutic remedy that has been studied and shown in a robust manner to cure prostate cancer, none of these have shown that as yet. They continue to be studied, however. In Jamaica, currently we are actually doing a study with guinea hen weed and prostate cancer to see if there is any benefit to being on it. So as time elapses, as we have more information, perhaps some of these herbal remedies may have a beneficial effect on prostate cancer. But as of this point, we really don't know.
Okay, thank you very much. Dr. Aiken, I thank you so very much for, taking time off to be with us on the program. It was really a pleasure having you on board. Some of our comments on our WhatsApp chat, they've praised the information that you've put out. They're very thankful for it, and we're very happy. As I said earlier, I'm extending an open invitation. I would like to have you back at some point so we can do some further discussion on the subject matter and probably other areas relating to urology and so. Any closing comments you'd like to make before we go?
Well, I'd just like to say it was my pleasure being here, and I look forward to a repeat visit. I would love to do this again, perhaps to speak on other aspects of men's health. But before I leave, I would like to encourage Grenadian men to go to their physicians beginning at age 40. Remember, early prostate cancer does not cause any symptoms whatsoever. You can feel well and feel fine, but you have a cancer that's growing in you. And the only way to know for sure is to go to a doctor and have your prostate examined and the PSA test done. So I really strongly encourage Grenadian men beginning at age 40 to avail themselves of the tests for prostate cancer screening.
Thank you so very much, Doc. It was indeed a pleasure. Dr. Nixon?
Dr. Aiken, thank you so much. I know I can rely on you. I want to thank you on behalf of the Grenada Cancer Society who's really spearheading these series of programs. Thank you very much for being very informative. You almost sound like a Grenadian, so I think we're going to have to give you a visa here. We really look forward to sharing more, yes, on men's health and especially urology, but on the other aspects of health. And hopefully this discussion can continue. This is Cancer Awareness Month, and we really wanted to focus on this. And I think this has really been a great lesson for us. Thank you very much for the time. Thank you for the work you do. Thank you for the lessons that you shared tonight. And we really look forward to having you more. And I miss just sitting and chatting with you, but you know how it goes. Thank you. I said thank you for lending you to us tonight. It was really good having you with us for an hour and a half, 2 hours. Thank you so very much. I can't thank you enough.
You're most welcome. It was my pleasure.
Dr. Nixon, thanks again, and to all our viewers on GBN Television, our listeners on K105, our Facebook and YouTube viewers, we thank you very much. We thank you for your questions, your comments. We look forward to being with you next week as we continue with Doctor on Call. Don't forget the focus, the month of February, cancer awareness. Thank you, and do have a good night. Thank you, Doc. All the best.
Thank you. Thank you.
Hold on, babe. Hold on.
Drug abuse, cancer,